I'm self-employed with a small business. I've got a handful of employees, and part of my incentive package for them with their salary is that I cover their health insurance. I came across Blue Cross Blue Shield 15 years ago, and I've been with them ever since. Blue Cross has made a difference in my life and my employees' life by giving us the security of knowing that Blue Cross Blue Shield will stand behind us, whether something planned or something urgent. We have Blue Cross Blue Shield to back us up. That gives us peace of mind.
Doctors New Orleans is underwritten by Blue Cross and Blue Shield of Louisiana, Winn-Dixie, and New Orleans Living Magazine, highlighting the best of our city.
Welcome to Doctors New Orleans, where you get to see firsthand how some of our local leading healthcare experts tackle health issues that are important to you. I'm your host, Maria Muro, and each week our goal is to help you take charge of your health. On tonight's show, we get the facts on gut bacteria. Then we cover some common foot problems experienced by diabetics. We also get the facts on complicated pregnancies. And lastly, a doctor discusses surgical procedures for patients who suffer from chronic migraines. In the second half of our show, we will discuss pelvic disorders. So now let's get started.
How far would you go to protect your child's health? If you're like most parents, that's a distance that can't be measured simply in miles. It's doing whatever it takes, no matter where that takes you. We know how far you'd go. We've been there. In fact, we go there every day so that you don't have to. A fully dedicated pediatric ER and the region's first and only on-site helicopter dedicated to kids, wherever they are. Children's Hospital New Orleans, caring for every child as our own.
Did you know that our gut contains tens of trillions of bacteria, 10 times more cells than in our body? Dr. Krishnan at West Jefferson Medical Center explains more.
My name is Dr. Sarath Krishnan. I'm a gastroenterologist at West Jefferson Hospital. We treat the entire gamut of gastrointestinal issues from the mouth to the rectum, as well as the liver, pancreas, and spleen. It's estimated that there are at least 10 trillion bacteria in our gut. And if you look at all the different species and the entire DNA of the bacteria, it's more than 10 times as much as the entire human genome. So we actually have a very mutual relationship with the bacteria. They need us as hosts, but we also need them to carry out our daily processes, such as completing digestion of carbohydrates, protein, and lipids. But also they have other roles as well. They help with forming our immune system, and they also help with forming some other factors we need, such as vitamin K, which helps with some clotting factors. It's actually one of the hardest things for us to diagnose because a lot of patients can come in with very generic symptoms such as abdominal pain, bloating, nausea, vomiting, diarrhea, or all of the above. And there's so many things that can cause that. So it's not always the easiest thing to determine, and it's always something that you have to keep in your differential so that you can actually diagnose it. And we can often see it in certain disease processes such as irritable bowel syndrome, which is something that's very common in the community where people may suffer from these symptoms. If someone's been diagnosed with an abnormality where they have small bowel bacterial overgrowth, then the way we treat it is to give a course of antibiotics. And sometimes the first cycle of antibiotics will work, but then you may need to give another cycle if it doesn't treat all the bacteria that's in the gut. And other ways to do it is you can replenish the good bacteria in the gut by taking probiotics, which is something that's becoming a little bit more knowledgeable in the community where people hear about lactobacillus that's in certain yogurts. It helps replenish the good bacteria in our system. If the small bowel bacterial overgrowth goes untreated, the main risk factor is the symptom side effects that patients can get, and it's very difficult to live through that on a day-to-day basis. Bloating is one of the more common ones, abdominal pain, nausea, vomiting, fatigue, and then you can also get an abnormality in your B12 levels, so you can become B12 deficient. Folate, interestingly, actually increases in patients with small bowel bacterial overgrowth because the bacteria themselves produce folate. And then also diarrhea is a very common symptom, but a specific type of diarrhea known as steatorrhea, which is a fatty diarrhea where the stool can actually float in the toilet because there's so much fat that gets expelled out of the system. One of the ways to prevent abnormality of gut bacteria is actually to adjust your diet. So there's that old adage that you are what you eat. And it's found that certain diets, especially the Mediterranean diet that has a lot of olive oil and healthy fruits and vegetables, is actually good to prevent a lot of the bacterial overgrowth that can occur.
Imagine the world through the eyes of your child, a place full of giants and unreachable places. Now imagine a world if it were designed to fit them, a place where the giants come down to their level. And even the smallest detail is, well, smaller. A place where everything revolves around the kids and their health. Not only did we imagine such a place, we built it with the help of our design team, of course. Children's Hospital New Orleans. Caring for every child is our own.
Diabetes is one of the most common reasons people seek relief for painful feet. The most common contributor to diabetic foot pain is a nerve problem called peripheral neuropathy. This is where the nerves are directly affected by the disease process. Dr. Vijay, a podiatrist at Paradigm Health, explains more.
Diabetics, they come to me particularly for routine foot care and preventative medicine. One of the more important reasons for them to come is because of the diabetic neuropathy. Diabetic neuropathy, of course, is a loss of sensation due to the diabetes affecting their peripheral nerves, so they lose sensation in their feet. Typically, a diabetic may walk on, for instance, a thumbtack or their insulin needles in their homes and create injury. Well, they don't feel it until they take their shoe off and they see blood on the floor. So then it will come into me, of course, and we would assess that, treat the wounds. Now, wounds in diabetics don't typically heal like a normal wound. And diabetic wounds take a little bit longer to heal because of their nutritional deficits they may be incurring, or the autoimmune part of a diabetic neuropathy as well. So we have to be extra careful to take pressure off of these wounds. Daily or weekly wound care is necessary as well. The wounds typically don't respond to typical neosporin. It needs daily or weekly debridement sometimes to restore circulation to those wounds. So that's an important thing to treat with a diabetic as far as wounds. In essence, diabetics, one of these sayings I always tell my patients is, in diabetes, things that are usually little anthills become mountains. Okay, to a diabetic, an anthill is a mountain because those small injuries over time lead to larger injuries, which secondarily lead to amputations at times. So I implore that all diabetics come to me for a routine checkup at least. We give them an overview of their risk. If they have a low risk, we may see them every 6 months. If they have a moderate risk, maybe every 3 months. And if they're high risk, we may see them on a monthly basis to prevent wounds, to prevent damage to their feet.
Welcome back. The new year is right around the corner, and if your resolution is to finally quit smoking, we have the tools that'll help you. Take a look at this success story.
I started smoking at 25 after my second child was born. The second child was born severely jaundiced, and the people I were hanging around were constant smokers, and I was a nervous wreck. And that's when I picked up my first one. So roughly I've been smoking about 40 years, and it's definitely time to quit. I just haven't been successful at it. it's an addiction. It is an addiction. There's no getting around it. I actually found out about the program through my baby sister, and she gave me the 1-800-QUIT number. And I called, and I went to the website, and I did some reading up on it.
Any Louisiana citizen who began smoking cigarettes prior to September 1st, 1988, can enroll in the trust. The trust provides medical services that are designed to help people stop smoking. That includes a basic office visit with your doctor. You have access to counseling programs, which are highly effective in combination with medication, and we cover all the cost of medications that are recommended for quitting smoking. The program pays 100% of all approved services. There's no out-of-pocket expense. Anyone who's eligible can quit smoking for free.
I think the first thing that interested me about the trust was that I could get help financially getting the medication. And the counseling part about quitting was interesting to me because you do need somebody to guide you. Now that I've been doing this and seeing Mickey, if I were to advise anybody that was going to quit, I'd tell them don't even attempt it without a counselor.
I am a registered respiratory therapist, and I'm also a certified tobacco treatment specialist. A specialist wants to help people quit as easy as possible with as few side effects or withdrawal problems as possible, and do it in a small, easy way. They realize that it's really good to be able to wean down a little bit at a time rather than stopping all at once.
So what we need to do is get into a program that knows you as an individual, knows your triggers, knows your particular needs, and then meets them, particularly as you encounter some of the predictable difficulties in smoking cessation.
Today we're going to go over lapses and relapses. Do you have anything you need to talk about before we get started?
Yeah, I goofed up last week, but
okay.
Once again, grandchildren and children. So.
On the days that you had high stress?
On the days that I had high stress, smoking does become a crutch. It becomes a go-to for stress relief, even though it's not relieving any stress. And it's a habit. But when you lose any habit, good or bad, it's hard to break. You know, and smoking's the same way. It's a hard habit to break.
She has a lot of stress in her life, and we're having to find new ways for her to deal with her stress and be able to release it and find new ways to relax.
I do start every day with yoga, and it's incredibly relaxing. And I'm more than likely the only yogi that does yoga not to the serene music. Mine's to rock and roll and the MP3 players in my ear, and that's how I shut it out. If I could listen to music 24 hours a day, inside my head, it would be a much easier process to quit.
Just think about it. When you first started, when the cigarette called, you answered immediately. Mm-hmm. Look how well you're doing now. Look how great you're doing with being able to wait as long as you are waiting.
Before I started the program, I was a 2-pack-a-day smoker. 2 packs a day, and on stressful days, maybe even a little bit more. So, and now I'm down to like 6 a day. And a non-smoker would think, oh my God, you're smoking 6 cigarettes a day? Well, from 40 a day to 6 a day, it's a huge step down. If you take into how much a person smokes, 2 packs a day, what that costs them, my gosh, that's a lot of extra money you can put on your house principal. I could be driving a brand new car with that money. So that's pretty motivating right there.
So if you're a pack-a-day smoker in this state, which is about the cheapest state in the nation to smoke, it costs you about $2,000 a year.
So if I'm not buying a carton of cigarettes, $56 goes into this little savings base that I have in my bedroom. Or if I buy 2 packs for the week, I'll just subtract the cost of those 2 packs from what a carton would cost, and I write myself a check and put it in the vase. So that's how I'm going to Disney World. Again, that vase is getting full. I got 3 days of Disney World paid for.
All right, so tell me your jingle.
No, you're going to make me do my jingle.
Yes, I want to hear your jingle. I didn't bring it with me.
I'll say the jingle, but I won't sing it.
All right, say the jingle.
It says, I'm a non-smoker, not a nicotine toker. Can't hang with puffin' jokers. because I'm a non-smoker. The money I haven't burned, I have dearly earned, and I'm going to Disney World.
And I'm so proud of you. That is so awesome. I think
And my
that's
vase
great.
is getting full.
And your vase is getting full, and that's
Got
great.
3 days paid for. I have every reason in the world to quit smoking. I've watched my father die of lung cancer. I've watched several friends die of lung cancer. I do not want to die that way. And then you have your family. You know what it's doing to your family. You know what they're going to watch you go through. And you have grandkids that are going, Grandma, please quit smoking. You know it's not good for you. When I look in their little faces and think, I might not get to see them graduate high school if I don't stop, it kind of tears me up, and it gives me more conviction. And I don't tear up easy. But yeah, they're a big motivation. And of course, what it's doing to me. You know, I know what it's doing to me. I can look in the mirror and see what it's doing to me.
But you're going to be a non-smoker, okay? And you're getting prepared for that. Her quit date is going to be in 7 days. So we're very excited, and she's excited. I know she's a little nervous about it because she is killing off her best friend, and she does get that feeling that she's a feeling of loss. And that's what I told her. It's okay to have that feeling of loss because you're actually gaining so much. And she needs to embrace that she is able to do it. I would like you to be 24 hours quit before his birthday. So I will give you a little slack because you did have a slip this week because of stress. But I want you to understand, stress doesn't go away. It's always going to be there.
For the A's. I mean,
I really want you to
shoot
try for the
A
A.
positively.
But I don't want you to beat yourself up if you don't make it, but try real hard to do it, okay? Call me. Let me be your cheerleader. Let me cheer you on and tell you how awesome you're doing.
I've tried to quit in the past, but I tried to do it on my own, and it didn't work. I do feel like this time I do have the tools. I have knowledge that I didn't use before. I have somebody I can go to that understands, knows the process. Yeah, I feel like I have all the tools to quit this time. I have quit smoking, and today I commemorate 1 month of being a non-smoker. And I am proud of myself. I feel a lot better. I really do feel physically better. I have no intentions of going back, and if I even feel myself falling, I will call Mickey, and I'll get the support I need. And she's very proud, and she told me once I was going to be her greatest accomplishment, and I don't know if I am or not, but I'm going to miss her. I feel like I made a friend.
Hi, I'm Sean Payton, and I'm here at my neighborhood, Winn-Dixie, where they stock all the fresh and healthy foods we need to live well. The Saints in Winn-Dixie are committed to help the people of Louisiana get fit and stay healthy. Exercising and eating right is easy when you have your whole community to support you, because together we are better. Winn-Dixie and the Saints invite you to join our team. It's easy, it's free, and it's fun. Sign up at livewelllouisiana.com today.
Midwives help women through childbirth. But when it comes to complicated pregnancies, rest assured, they provide a multidisciplinary approach to make sure their patients' needs and well-being is always a priority. Watch this.
If a complication arises during a woman's pregnancy or during childbirth, I have collaborative physicians that are available to me 24 hours a day, 7 days a week. I know who's on call when, and I know that they'll be available for that woman and to help care for them at that time. They're always a phone call away. I always make sure that they're aware that I have someone in labor so they can be on standby, and then once the birth is concluded, I call and say, hey, all is well, there's a new baby in the world. A lot of people automatically think, oh, you're choosing a midwife, oh, you must want a natural birth. Well, a lot of women do seek my care for natural childbirth. I do have a lot of women that see me as well who just want more personalized attention, but they also want the epidural almost as soon as they walk through the door. And as a midwife, part of what I really enjoy about the aspect of midwifery is we care for women with whatever their desires may be. I want to support them. I want them to feel like their choices are what's best for them, and to make sure that their choices are supported. For women who have had prior cesareans, they are able to see me in hopes for a trial of labor after cesarean. A lot of women nowadays are really understanding that there can be a benefit to having a trial of labor after a prior cesarean section. I do work in concert with my collaborative physicians with women who do want to have that vaginal birth after cesarean. We also make sure that the physician's readily available in case that there's any complications.
Know what?
What?
Since I got adopted, I've learned a lot about these humans.
I know. I mean, check out these two. It's Flirt City over here.
Yeah, I noticed that. It looks like my human is definitely into your human.
Oh, look! I think she's getting his number.
Nice.
Your human's got some sweet moves.
Takes after his dog. Oh, look, they're doing that thing where they put their arms around each other.
She kicked up a leg. It's like in the movies.
That's awesome. Looks like we're going to be hanging out a little bit more.
For millions of people who suffer from chronic migraines, there is now a procedure that might help. One patient discusses the toll migraine took on her and how she now found relief thanks to a local doctor.
I've had migraines for probably 10 or 15 years, and they got progressively worse. And I didn't realize how they were affecting me, but I was in pain a lot of the time. I found Dr. Tesler really simply because a friend of mine saw something on television and emailed me.
I watched my poor wife live through years and years of the misery of migraines, and it just seemed that there was no end in sight. Different medications were tried. They didn't work, or they would work temporarily.
Well, when I met with him, it was really kind of amusing. He said, come in when you have a migraine. And my migraines were typically in my forehead. And I did. I came in, and he gave me an injection directly into this nerve, and my migraine instantaneously disappeared. And I sat straight up, and I said, what did you just do? And he said, isn't that a great party trick? And we high-fived each other. And that's true. But it really was, I've never seen nothing makes your migraine go completely, leave in 1 second. And so that convinced me that surgery would probably be effective.
I watched Karen suffer for years with migraines that just never seemed to go away, and they were interfering with her work and completely changing the mood of the woman that I had married. So when this surgery came along, and particularly when she came home and told me about Dr. Tesler's neat party trick of trying out the nerve that was offending, I was all for it.
The migraines made it difficult to concentrate. And the medications that I was taking, which was anti-epileptics, have a tendency to make you lose words, which is not a good thing in my profession. I remember once I was trying to take a deposition, and I had a full-on migraine, and someone was working on the roof above us, and I was trying to take this woman's testimony, and I just couldn't concentrate. It was really a terrible situation. I couldn't wait to get out of there. The procedure went well. I didn't have any difficulties. When I was a nurse, I was an operating room nurse and a recovery room nurse in ICU, and so I knew what to expect. And I was, pretty bruised up at first, but it resolved fairly quickly, and with very, very little pain. And within a week, I was able to go back to work.
The care in the hospital was perfect. The post-operative recovery period couldn't have been easier. There was a little bruising, of course, at first, but the migraines went away. They stopped. No more migraines. And the best part for me as Karen's husband is I got my wife back.
I have occasional migraines, but they are a much milder quality and more easily controlled. In the past, before surgery, I would have a migraine, I would take the medicine, it would just sort of punch it down a little bit, and I'd continue on, but it really was never gone. It would last for 2 or 3 days. Now I can take a tiny bit of medicine, it's gone completely, and I feel completely clear. So it's made a big difference in my life.
Packers. Viking. Packers. Viking. Viking.
Red state. Blue state. Vegan.
Carnivore.
We come from different places.
Uptown.
Downtown.
Optimist.
We come to different conclusions.
Half empty.
Half full.
But when we live united, we create real, lasting change in the building blocks of life. The education, income, and health of our communities, our families,
united.
even the person next to us.
Live united.
Real change won't happen without you. So give, advocate, volunteer, live united. Sign up at liveunited.org.
All right after this break, we'll be back with Dr. Eric Lonseth to discuss migraine treatments and to take your questions. We'll be right back.
How far would you go to protect your child's health? If you're like most parents, that's a distance that can't be measured simply in miles. It's doing whatever it takes, no matter where that takes you. We know how far you'd go. We've been there. In fact, we go there every day so that you don't have to. A fully dedicated pediatric ER and the region's first and only on-site helicopter dedicated to kids, wherever they are. Children's Hospital New Orleans, caring for every child as our own.
One day I was riding my bike and I noticed a little pain. I'd never been there before. Went straight to the doctor's office and he confirmed it was testicular cancer. Before you get sick, you just have insurance and you don't think about it much. The experience we had with Blue Cross was fantastic. Finances are the last thing you want to be thinking about when you're sick. This whole thing's been going on for about 2 months, but I'm going to be dealing with it for a few years now until I get the all clear. Having the Blue Cross ID card in my wallet makes me feel secure, safe, and covered.
Good evening, I'm Maria Muro. Welcome back to Doctors New Orleans, and tonight our topic is migraines. Migraines are a neurological disease that cause a wide range of symptoms. The most commonly thought of symptom is a headache. According to the National Headache Foundation, over 29 million Americans suffer from migraine headaches. My guest tonight is Dr. Eric Lonseth. He's a pain management specialist with a reputation for excellence in the field of interventional pain management, with fellowship training and double board certification in both anesthesiology and pain management. He earned both his medical degree as well as his master's degree in public health from Tulane University School of Medicine. He completed his residency and fellowship with the University of California, San Francisco. Dr. Lonseth, welcome to the show. Good to see you again.
Good to see you, Maria.
I know we like having our chronic pain doctors on this show because it seems like you're always helping a lot of people, and we're excited to talk about migraines tonight.
Good.
Okay, so before we get to that topic, I just want to quickly touch on the whole opiate epidemic that's going on in our communities, because I know, there's a big difference between just pain management, interventional pain. So why don't you tell us about your practice and your philosophy?
Sure. Opiates have kind of run a little bit amok. So they are a good tool in a big bag of other tools. Unfortunately, sometimes when you think of pain, they become the only tool. Instead of the end of your train, it becomes the engine itself that's driving everything. So really, it should be used as a means of last resort. So what we do in chronic pain management or interventional pain management is we try more to use non-opiate alternatives, whether it's alternative medicine or whether it's an interventional approach, where we're pinpointing the source of the location of pain and using very minimal medication with minimal side effects to really hone in and decrease the symptoms from occurring.
Okay, and you found success in your practice with offering in-office procedures or minimally invasive procedures instead of, keeping people on heavy pain medication for life?
Whether traditionally people are going to think of sciatica and an epidural steroid injection.
Okay.
And so you relieve those symptoms with an epidural steroid injection. So that's what you would think of with minimally invasive interventional pain. But it also works across the board, whether you're talking about, abdominal pain or migraine headaches, neck pain, headaches, as we're discussing today. So it really works across the board of all pain symptoms.
Okay, wonderful. And tell me in your practice in terms of age ranges, the type of patients that you serve.
Sure. I generally serve people from the age of 18 till 118, if I do have anyone who's 118 years old. Although I do have some athletes who are 15 years old.
Okay, wonderful. And now in chronic pain management and in your practice, I know a lot of it is back pain, but we typically don't think of migraine pain. At least, the research I've done, it seems like there's just been a lot of attention now focused on migraines and that people can be helped.
Right. Right.
So do you feel that there's a bigger demand with patients, new patients coming to your office seeking help for migraines?
I think part of it has to do with the fact that we have to stop using opiates, which are being misused for migraines.
Okay.
And at the same time, there's a couple of new techniques that have been very dramatic in reducing the symptoms, both the intensity, the frequency, the duration of headaches. So that's become more apparent in the public, and so they're seeking out more treatment because it can really be a debilitating symptom. I mean, you're talking about really number 1 and number 2 reasons why you're going to a doctor: back pain and headaches.
Wow. Okay. For instance, my sister-in-law, she suffers with migraines, and at first I just, a lot of family members just don't understand it because we're at a family wedding,
right.
And then she just panicked and said, "Oh my God, I'm coming down with this migraine," and she had to leave. I mean, she had to actually leave the wedding, go home, and go to bed. So it's I think it's also misunderstood.
It's misunderstood in the sense that you don't see any of the symptoms, right?
Right.
There's no rash, there's no broken bones. So there's that on one hand. On the other hand, 80-90% of the people in the United States at one point are going to experience a migraine.
Wow.
So it is pretty common.
It's common. All right, so let's get started. So how would you define a migraine? What is a migraine, Dr. Lonseth?
There are several different types of headaches that we like to classify into different categories, and one of them is migraines. And what is common in migraines is it's usually one side of the face and not the other.
Okay.
Whereas you might have a temporal headache, a tension headache, or a cluster headache, or a sinus headache, it's usually one side or the other. It's often associated with nausea or photo or phonophobia, which means that you really don't want to be around bright lights or loud sounds. And I actually experienced 2 migraines in my life.
Okay.
And one of them I remember, and there's always after exams. There's always after a period of stress, and I had the chance to relax. And
right.
I walked into a Walmart. And I walked in, and I looked around, and I couldn't understand how everyone could tolerate how bright these lights were. And I literally wanted to tell somebody, listen, can you tone down the lights? This is way too bright. And I found some sunglasses. But that was what's called an aura, which was an indication that shortly after that, a migraine was coming. So migraines often have auras, some kind of signal beforehand that lets you know 10 to 30 minutes that a migraine might be coming.
Okay.
Could be a smell, could be a sound, could be bright lights, could be a strange sensation, tinglings. And so you get an aura. Another thing is that migraines last usually anywhere from 4 hours to 24 hours, unfortunately sometimes longer. And there's often a family history.
Okay. And who typically gets migraines?
Right. Typically, you're going to find the age range anywhere from 25 to 55.
Okay.
But think about, it's more common in women, about 3 to 1. It's certainly not a disease only of women, but more frequently found in women. And that might even have to do with some of the hormonal changes as well, because we find that women who do have migraines, about 50% of them have their migraines right before or during or right after their period. And then when if they're on birth control pills, that often helps alleviate some of their migraines.
Okay, we actually did get on social media a woman who wanted me to ask you exactly that. Are they, she said that she basically always gets a migraine before her period, and is there anything you can do for that?
Right. Whether you can treat them directly by the migraines or trying a birth control pill often can help as well.
Okay, wonderful. All right, so with migraines, when does it become a chronic issue?
Yeah, so regardless, migraines can be very debilitating. Just like you explained, your sister wants to go off in a dark, quiet room.
Right.
Many people, or some people, actually go on to develop chronic migraines, where they can have the migraine headaches as frequently as 15 times a month. Wow. And the headaches aren't only for 4 hours, they can last for an extensive period of time. So there's different treatments that we do, whether we're talking about people who have migraines, once in a while, once a month, and people who have migraines 15 times a month. It's a different type of treatment.
Okay. And so obviously these people who are suffering from chronic migraines, I mean, that affects their life in a horrible way, right. I would imagine.
I think they're talking about...
I'm sure there's depression that comes with this.
With any chronic disease, there's going to be depression, but it is very debilitating. It is, you know, if you have 15 headaches a month, that's half the month. And of those 15 headaches, half of those are going to be disabling and you can't work or you can't go to school. So that's a large part of your month that you're not functioning at the capacity that you want to, that you're not being the spouse or the parent or the friend that you want to be, that you're not working or that you're not going to school.
Right.
And that's,
Right.
that's a significant chunk of somebody's life.
Well, I went to Dr. Lonseth's office, visited a couple of months ago, and you actually had an attorney patient, and I don't recall her name right now, but she was, you know, she had a thriving law practice, and she basically had to give up her law practice because of her chronic migraines.
That's right.
You know, and she has children, and that's when that's why I wanted to do a show on migraines tonight, because I saw that it just really, I mean, took this woman's life upside down, and the fact that there are options that we're going to talk about is very, very exciting. So if anybody does have a question, don't be shy, feel free to call. Dr. Lonseth can answer any question you have. So, all right, so let's talk about the different treatment options. I want to talk about the evaluation process. Okay, so a person doesn't really know if they're, I mean, like you said, migraines are self-diagnosed typically? Why
Typically,
is
they're
that?
self-diagnosed.
Tell me about that.
Typically, there's something that you experience very infrequently.
Okay.
And they kind of have a known symptom base. So, you know, you have an aura, you have nausea, you have to get an aura, a throbbing pain in one side. So it's typically self-diagnosed. If it becomes more frequent, then people usually seek out more advanced treatment, whether it's through their primary care or through a headache specialist like a pain physician or a neurologist.
Okay.
You know, part of the initial evaluation is you want to identify triggers. The best thing to do is identify triggers.
Okay.
Poor sleep can often make them more frequent. Sometimes exercise, smells, stress, certain foods. So if you can identify where are the triggers and limit those and limit the headaches, that's best.
Okay.
Then you're looking at somebody's medical history. We're going to try certain medications. We're going to try medications to help prevent them from occurring if they have them frequently, or to stop them when you have them. But there's side effects with these medicines, and these medicines also have other effects on other parts of the body. So we want to look at you as a whole. What are some of your other medical conditions as well? We want to try certain relaxation techniques, or acupuncture as well can work really well on migraine headaches, and build in a stepwise fashion.
Okay. All right. So before we get to the in-office procedures that you offer, we're going to show you a quick video of a patient of Dr. Lonseth who had a procedure done. Her name is Lisa. Take a look.
My name is Lisa Sisser. I'm a patient of Dr. Lonseth. I've had migraines probably since my early 20s, so I've had them a long time. Depending on the degree of them, I either can't get out of bed, or I'm dizzy, throwing up. I get the aura, the bright lights where I can't see anything. I've been out before having dinner with friends and had to leave and drive home with polarized sunglasses just to make it home because of the light. So treatment for migraines is a lifesaver for me. I just had this phenocath procedure. I was probably about a 6'7" prior to, and now I'm about a 2'3". It's pretty easy. You just lay down, and well, first they give you an injection, numb up everything. Then you lay down, and then they find their way up, and then after about maybe, the only bad part is you get a little nasty taste, and then it goes away after a couple seconds. And then within a few minutes you have relief and feel so much better. If you're nervous, it's not bad. It's over within seconds. I would definitely give it a try. Anything's better than laying in a bed with a migraine and not being able to go about your life. 5 minutes of your time is worth it. I love Dr. Lonseth. Everybody I know will be coming here to take care of their headaches because I'm a walking testimony.
Well, Dr. Lonseth, Lisa's story is great. So tell me, she was actually in her office when this was filmed. She had just had a procedure?
That's right.
Tell me a little bit about her history.
She had chronic migraines, and she had tried medicines to help prevent them from happening, because she had migraines, I believe, 6 or 7 times a month.
Okay.
And it interfered with her work and her family. And so in this case, we did something called a sphenopontine ganglion block.
Okay.
It's actually an older technique, but with a newer instrument, which makes it more successful. And so sphenopalatine has a strange word. I think spheno, Greek for wood chip, and palatine, Latin for palace. So think of this wood chip palace in the base of your nose.
Okay.
And there sits this plexus, this ganglion of nerve, this train station of nerves coming together. And where it goes up to the trigeminal nerve, which is a nerve that goes up to the brain that is thought to contribute in a large way to migraine headaches. And what we can do is access the base where that trigeminal nerve is through a trocar that goes in the nasal passage.
Okay.
And spray some local anesthetic. It's a very simple procedure. It literally only takes minutes.
Okay, I know it's an exciting procedure, and we're going to continue talking about that, but we have somebody who's been waiting to ask you a question. We have Christy on the line. Good evening. What is your question for Dr. Lonseth?
Thanks for taking my call. My husband currently suffers from chronic cluster headaches, and he currently takes a drug called Zomig nasal spray, and it has been a miracle drug with no side effects. But even with these meds, I was wondering, do you have any procedures that may be able to help him, like Botox or the procedure that we were just discussing?
Yeah, that's a very good question. And I think Botox is a very kind of like in the environment, kind of in the media treatment for headaches. It is a very select type of headache that you want to treat with Botox, and it's migraines. And I'm happy to talk about Botox in a few minutes. So I would not use Botox for a cluster headache, but I would use the sphenopalatine ganglion block. It is very successful for both migraine headaches, cluster headaches, tension headaches, trigeminal neuralgia, mass effect headaches from cancer. So I think that would be a very good treatment option.
Okay, so thank you for that call, Christy. So let's talk about this this procedure called sphenocath, I guess is
sphenopalatine ganglion block. Yep.
Let's talk about that. So again, where is this area that is treated?
Right,
in the
it's
nose?
in the middle meatus, in this nasal passage.
Okay.
In the sinus. That's a good view. And so that catheter is going into the nasal passage, and then it would curve a little bit more to get into the nasal passage. If you imagine, it would go down to about 6 o'clock on the screen.
Okay, and so someone comes to your office. Tell me about that and how that works, because it's an in-office procedure.
It's an in-office procedure,
wow.
And they can literally drive themselves home. First thing I do is numb up the nasal passage real well with a squirt of some local anesthetic. And that's honestly the most uncomfortable thing about the entire procedure, is getting a squirt of local anesthetic in the nose.
Okay.
Because it's a lidocaine, high concentration of lidocaine, and it usually tastes like metal or pennies. So I could provide a little Capri Sun. I don't know why Capri Sun. I started with Capri Sun. I never drink Capri Sun, and yet that's what a little squirt of Capri Sun seems to do well to clear out the throat. Numb up the nasal passage. Then they lay flat. I use a little bit more of a gelatinous lidocaine, and then I introduce the trocar, a soft trocar, into the nasal passage. Through that, I thread another trocar, and then I make a flexible trocar, and then I spray more local anesthetic at the base of this ganglion of nerves.
Okay, what happens to those nerves?
And what it does is it's almost like it turns the computer on and off. Okay. It reboots the computer so that signal of pain going up the trigeminal nerve is stopped. And I'm a big fan of medicines to help prevent headaches. I'm a big fan of Botox. What's special about the sphenopalatine ganglion block is not only does it prevent headaches, but it actually cures the headache when you have it. So typically it's going to take about 15 minutes, maybe a couple hours, but it's not atypical to have people literally while you're doing one side and you're about to get ready to do the other side, they say, wait a second, this side of my headache is gone. I still have this side, but this side is gone. So it can be instantaneous.
This is fantastic. So with Lisa, that was just a great video. I learned a lot about this procedure, is that she said she walked in, had the procedure done, and the pain went from an 8 to a 2.
It's a very rewarding experience to know what a migraine is, to know how debilitating it can be, and to literally, while they're laying on the table, inject some local anesthetic, and it can be, I find 80% of the time it's working extraordinarily well for people with cluster headaches and migraine headaches. Okay. And for many of the patients, it's at that moment that they start to experience.
Okay, so this is a 5-minute in-office procedure.
Yeah, 5-10 minutes.
Okay, and I know very important question people want to ask: is this covered by insurance?
It is. It is. A sphenopalatine ganglion block has been used in medicine for a long time. Okay. What makes it more accessible now, it's kind of silly, is that it's a curved catheter with a trocar that goes through it. And it's almost to me akin to the fact that we had the wheel and we had a suitcase, And it took 1,000 years, or not 1,000 years, but it took many hundreds of years to somehow put those two together.
To get this
Right.
fantastic.
So we had, I remember in fellowship, which was not, 10 years ago, we would just use a Q-tip, a straight Q-tip. And if where I'm trying to get to is right here, I had a straight Q-tip, and I would get close to it, but I wouldn't get all the way where I needed it to go. So now here comes a curved trocar through that another tube and then a spray, and it gets right where it needs to go. And it's not a genius device, it just happens to be the right device at the right time.
It's the right device, and obviously, what about patient satisfaction?
Well, if you have migraine headaches and you take away those migraine headaches or cluster headaches, then the satisfaction is very high.
All right, excellent. We have another call. We have Grace. How are you, Grace? What's your question for Dr. Lonseth?
Yes, Dr. Lonseth. I have a condition, degenerative disc disease, and I have 4 fusions and a cage on one side of my neck, and I get tremendous headaches where I'm disabled. I just can't do anything. I can't think. I can't do anything. I've had a rhinoplasty where they burn the nerves, and that wore off. It gave some relief.
And how long did it take to wear off?
It took about a year and a half to 2. It lasted about 2 to 3 years, probably.
Okay. So not all headaches are caused from, excitation of the membranes around the brain or the nerves. Oftentimes, headaches can be caused from tense muscles or degenerative discs or joints. And in this case, what we're experiencing is problems with the joints themselves. Okay. And there's a technique called a rhizotomy, or a radio frequency ablation, or an RFA, all describing the same thing, where it's stunning the nerve that gives sensation to a joint with heat. It's a tip of a needle that vibrates so fast that it creates 80 degrees Celsius. And part of the way that our body communicates signals is with chemicals, and another way is through electrical currents. And in this case, there's this protective coat around a nerve that allows the nerve signal to communicate faster. So what we're going to do is we're going to stun that coat so that it cannot communicate the signal of pain, so that the brain can perceive the pain. So even though you still have that degenerative problem, you're not feeling the pain. And in this case, you're not going to feel the headaches as much. It's a very safe procedure. We do it for the neck. We do it more frequently for the low back, for back pain. And my God, if you got 2 years of benefit with a radio frequency ablation, I would just repeat that again. So the fact that it wore off after 2 years, I'd say that's why it's going to last anywhere from 6 months to 2 years. Okay. And so to not have headaches for 2 years, I would repeat that procedure again.
All right, thank you. We have another caller. We have Gary on the line. What is your question for Dr. Lonseth?
Yes, it's more or less a statement. I wanted to say I've had migraine headaches when I was very young, and like 6 years old on up to my junior high school, maybe one or twice a week. And I'm glad they got something. Now, they tried all kinds of procedures on me that they had at the time, but that was a long time ago. I'm 62 now. I missed a lot of school because of this situation, and they put wires on my head and all kinds of different techniques, brain wave, they call it, and so on and so forth, but they never could figure it out. I was just wondering if you knew probably the root cause of it. I'm glad it went away finally. I don't know if it was genetic or what.
Yeah, you raise a very good point. So we talked about how most people who are experiencing headaches are anywhere from the age of 25 to 55. And as you get older, the frequency of the migraines decreases. But in many cases, you can have childhood migraines as well. And so I believe the caller said he was 8 years old. Mm-hmm. Frequently you'll get maybe start to experience around 10 years old. Okay. And unfortunately, just like the caller mentioned, there's a lot of school that's missed. Just like you miss a lot of work, there's a lot of school that's missed. So it's very unfortunate. Why are there migraines? We don't know. Is it because of oversensitivity to the membrane around the brain? Is it because the chemicals that are released in the body, are they making the blood vessels contract and dilate too much? We're not sure. Is there a genetic component? Well, it sure seems to be that it runs in families. Okay. 80-90% of the people, although we can't necessarily find what the genetic predisposition is. That being said, though, there's a group of symptoms, and we treat those symptoms. Okay. And the best thing to also do is to see if you can identify the triggers, and reduce those triggers as well.
Okay. Well, let's get to Botox. We only have about 6-7 minutes to go on the show, and I know that this is a hot topic when it comes to migraine treatment. Okay. I mean, it seems like every time I'm watching TV, there's that migraine Botox commercial. And so tell me, what is Botox and how is it used for migraines?
Sure. It is first discovered in the 1990s as it's applied to migraine headaches. So wrinkles, creases, falls into practice there, very successful. And like many things in medicine, we find, oh, look at this. It also helps to treat something else. So all these people who had creases or wrinkles getting treated with Botox, a lot of them who had migraines were having less and less migraines.
Okay.
So they did a study with about 1,500 people, and then it got approved, I think, in July of 2010 for the use of chronic migraines. Why it works? Well, it could have to do with muscle tension, but not directly. It may have to do with the release of muscle tension on the nerve, may do with decreasing a chemical that's released in the body called acetylcholine, decreasing the sensitivity of the pain receptors to pain, or increasing it. But it's been found to be very effective. And in this case, it's used for people who have migraines 15 times a month, or that last for more than 4 hours, and they've tried other things to prevent them and to help them occur. It's done, usually try it once or twice before you make a judgment on how it works, but it can be very effective in treating migraines for about 90 days at a time.
Okay.
There's a number of locations that we treat in the front, which often means that all the people with migraine headaches don't have any frontal creases. The temporalis muscles, and in the occipital region and the shoulder, there's a group of several areas that we use to treat migraines, and it's very successful by people who do it frequently, by practitioners who do it frequently.
Okay, and also on social media we had a question about TMJ, and is Botox, a woman she has severe TMJ, and she says it's causing her to have migraines. Do you use Botox for that as well?
Yes,
Where do you inject your patients?
Well, for migraines, we're doing in certain locations, here, a couple here, 4 here, and along the ends over here. So there's a pretty standard approach.
Okay, and so Botox, again, we know that Botox is expensive, okay, because most people know about Botox for cosmetic reasons.
Sure.
But this is a medical issue. So is it something that is covered with
It's covered by
insurance
as long as it's appropriately used for chronic migraines. It's actually interesting. It doesn't work for periodic migraines. It doesn't work as well for people who have 1 to 2 migraines a month.
Okay.
It doesn't work for tension headaches or cluster headaches. So it's very successful when used correctly for chronic migraines for people who have them frequently.
Okay, and so Dr. Lonseth, migraines, obviously it's a great topic tonight. I think that what I've learned is that not every migraine is the same, right?
Right.
Just like not every patient is the same. So if somebody is experiencing migraines, they've been kind of getting used to living with migraines. I mean, what are your words of advice? Because obviously, you've introduced some techniques or in-office procedures that can make them more comfortable. What are your thoughts on that?
Right. I mean, that's the whole reason I got into pain medicine, interventional pain medicine. There's activities that are important to people. It's family, it's work, it's sport, and they can't do it. And here you are with the tools available to help them participate in those things that are important to them. So when people find that they're limited from their activity, when it makes them sad, when it makes them avoid these activities, that's when you should go seek a doctor or a specialist. And so if migraines are preventing you from working or going to school or keeping you asocial, and over-the-counter medications aren't working and triggers aren't working, that's when you should go seek a specialist.
Okay, and again, with the sphenocath, because I know one question that we had was how often do you have to get the spheno block?
Right. So Botox has pretty strict guidelines and works very well every 90 days.
Okay, so Botox 90 days,
right.
Okay.
And sphenocath is a little bit more variable.
Okay.
Initially, you'll do it once and maybe a second one in a couple weeks later and maybe a couple of months after that. But then really we're prolonging it, whether it's every 6 months or a year or every 2 years.
Okay, so these patients will come in, they can drive themselves to your office, get this procedure done to help them with migraines and be done. So there's no downtime, no surgery.
I usually have them wait about 5-10 minutes to make sure that they're comfortable, and then they go home.
Okay, well, this is fantastic. So, Dr. Lonseth, before we sign off, I know that you're an active blogger. Why don't you tell me about that a little bit?
Yes.
If anybody wants more information.
At any time patients have a question, I often will put something on my website, lonsethpain.com.
Okay.
And I have a feeling with these phone calls, I'm going to put something on migraines.
Absolutely, absolutely. Well, Dr. Lonseth, thank you for your time. We want to thank you for the interview, and to our callers, thank you for calling in. For those who wish to receive information or you want to contact Dr. Lonseth's office, you may call 504-327-5857, or you can visit his website, lonsethpain.com. I'm Maria Muro. I want to thank you for tuning in to Doctors New Orleans. Remember, if it's about health, we cover it, and we want to hear from you. Thank you for your calls tonight. We hope you found this show informative, educational, and inspirational. Stay healthy, and good night.
Doctors New Orleans is underwritten by Acadian Ambulance Service and New Orleans Living Magazine.